In dentistry, the process of selling is referred to as case acceptance. Despite the poor associations that people have towards sales, in dentistry, the better you are at handling the sales process, the healthier and happier your patients get, and the more rewarding your work as a dental team member becomes. So let's get started by defining what exactly is a sales line. The sales line is an organized flow of actions that happen from the first patient interaction, the discussion of findings, and finally the completion of a financial agreement and scheduling that patient for delivery of services. So the sales line is a gradual progression that every patient goes through from being absolutely unfamiliar with the practice to complete love and trust in your knowledge and capabilities. This process can be engineered to proactively create a shift in the patient's perspective about the unique experience you can provide for them. Emphasis on the word unique, meaning it's an experience they can get anywhere else. For the sales line to operate smoothly, all team members need to have a clear understanding of their position and the role they play within that sales process. It doesn't matter which position you have in the practice, even if you don't do any type of sales or case presentation, it is very likely you are influencing the sales line in one way or another. The typical case acceptance process goes like this. First, the patient becomes familiar with the practice, usually through a promotional campaign. They call the office or walk in and they have an interaction with the receptionist or scheduling coordinator who, after gathering some personal and insurance information, schedules the patient for a consultation. In a conventional production line, raw materials go through a conveyor belt and stop at multiple stations where these materials are gradually transformed into a valuable product. In a similar way, when the patient arrives in the office, we're dealing with someone who has a certain expectation about the dental experience. And it is your job as a dental team member to help transform that expectation into a unique, valuable experience. After the patient meets the staff at the front desk, they are welcomed into the clinical area, usually by one of the assistants that will start getting clinical information and gathering some records. By the time the patient gets to see the dentist, they have interacted with 2 or 3 different team members. And before they leave the office, they will also meet with the treatment coordinator to help them make arrangements, and if everything goes according to plan, they will once again meet with the scheduling coordinator to schedule an appointment for services to be provided. Understand that as one of the stations in this sales process, you are actively transforming the perspective of the patient. Maybe this patient had a bad experience before and had poor expectations, but when they encounter someone who is welcoming and professional at the front desk, their perspective is switched from negative to positive. In a similar way, each team member has an opportunity to provide added value to the patient's experience. A dentist can do a follow-up call for a patient in pain. A treatment coordinator can send additional information about treatment alternatives. Anyone can send a thank you note or an empathy letter when a patient is going through a difficult time. These are simple actions that carry a lot of value for people, and there's a lot of different ways to provide an experience that goes beyond the patient's expectations. Remember that doing your job provides you with an income, but going the extra mile opens opportunities for recognition and advancement. Not to mention, it makes your job truly rewarding. Thank you, and I'll see you in the next video.